Welcome to the Equine Vet Connect podcast. I'm your host, Dan Carter. I'm a veterinarian and a farrier. The goal of this podcast is to educate horse people, break things down, bust myths, and keep it real. Speaking of breaking things down, here's my legal disclaimer to keep my attorney and insurance company happy. While I am a vet, I may not be your vet. Contact them before trying anything you hear on this podcast. Remember, just because you watched it on YouTube or heard it on a podcast does not mean you can do it. Please use common sense. All right, welcome back to the Equine Vet Connect podcast. I'm Dan Carter. We're here in the studio, treatment room 1. I got Dr. Brown with me today. Dr. Caroline, how are you doing this today?
I'm doing great. It is a good day.
It is a good day.
It is a good day. All the planets are in a line today, so.
I know, now everybody's going to know when the podcast happens. So.
I know. Gave it away.
Yeah, just gave it away.
Gave it away.
Yeah, I just know it's springtime. Mm-hmm. It's not freezing cold. Stuff's turning green again. Life's pretty good.
Life is great.
Life is good.
This is like the type of weather that you actually enjoy working outside.
I'm built for this. Mm-hmm. Like 70 degrees. That's like my optimal operating temperature.
Yes, I'm like, I actually enjoy working outside in this. I'm like, this is why you do it. And then
yeah, you put
it's
up.
It's a happy medium.
I always say we put up with July and August. Mm-hmm. We put up with January. But, the rest of the time in Georgia, it's pretty dang nice to be outside. So, well, we're going to be talking more about pregnant mares today. We kind of, in one of our episodes we got your mare ready to be bred. And then we got her pregnant, and now she is pregnant, and we want to talk about maintaining that, talk about things we need to do throughout this pregnancy to get us ready for a good foaling and produce a good foal. We're going to talk a little bit about nutrition, vaccines, general health and wellness to really produce the best quality foal we can, and also make sure this is safe and healthy for your mare. So.
And I'd say probably the most common question I get is, how long is my mare's pregnancy? And I'm like, that's a great question.
So answer that. Let's hear this.
So I think generally we say that the average length of a mare's pregnancy is about 11 months. When we do our kind of calculations of when is my mare's due date, we calculated about 335 days is kind of our sweet spot. But every mare is going to have her preference. Our bare minimum that a mare has to hit for them to be considered a full-term pregnancy is 320 days.
Correct.
That's our, big checkpoint of anything before 320 is considered premature. And so there's going to be some, steps that we need to take if we do have a mare that foals before that time that we need to do just to make sure that foal is able to kind of survive. But every mare is going to have their point. They say that mares can go average, they can have a normal pregnancy up to 380 days. I've seen horses go to almost 400 days, and that foal is still completely normal.
I've seen the same thing. I always say, day 325, I'm going to mark you safe. Mm-hmm. You're marked safe. 325, that's safe day. Mm-hmm. Anything after that should be a normal parturition, should be a normal birth, should be a normal foal. Mm-hmm. But as far as after that, how long they can go, I think my record has been 420 days.
Yeah, and it was a normal foal.
Normal foal. We were checking fetal heart rates. We were watching it with an ultrasound. We were checking the mare. Everybody was healthy, happy, and she finally decided to foal. Everything went perfect. Foal was normal. Mare was normal. All was good.
That's just where she wants to live. And most of these mares too, they kind of pick their day and they stick to that. So for any sequential pregnancies, they usually tend to carry kind of around that time as well. And I say donkeys and minis usually like to go longer too. It's not uncommon. We have donkeys going well into 400 days. Yep. So,
and that's the thing. That's one of the things I tell people. If you've got a mare, that's one of the things you'll kind of figure out over multiple foals is you kind of get a rough idea. She's one that likes to go 2 weeks late. She goes a month late, or maybe she's one. I get a few that they're going to go consistently a week early.
Yeah.
So if you kind of run that average, I usually run an average like 330 days. And so that average in there, I have some may go 330, and then the bulk of them don't go too much past that 330 mark.
Not too terribly, but
we do get those outliers.
You get those special mares.
So I was like, so if we got an idea of when she was bred, that is a really good thing to know.
But kind of sum it up, this is a year of your life, at least.
Yes.
So, and there's a lot that can happen in this year. And so, we want to make sure that we're taking care of these girls through the duration of it. So there's kind of some big checkpoints that we like to hit, especially in those first, kind of 30 days after we've done the AI, we've, done the cover, where we need to, check to make sure that we have a pregnancy and that we are set to kind of maintain that pregnancy. So our first time that we can actually see that embryo is right at about 14 days. That's where I like to do my first check, and that's for a couple reasons. So it's the smallest that it's going to be at that point, that we can visually see it, is at 14. And so if the mare is pregnant, we can say, great, we've got a pregnancy. Let's check her again in a couple weeks to make sure we have a heartbeat, which is the first time we can see that is about day 25 to 30. If we're not pregnant, then we know that we can kind of start preparing to get her pregnant on that next cycle. And at that point too, it's our best time to check for a twin.
Yes.
So twinning in horses is something that we need to be extremely careful with. I feel like you always, every year you hear some story about some miracle mare that gave birth to twins and they're super healthy and everything, and it gets everybody's hopes up. But, I'm sad to say that it's the other 99.9% of these mares that end up trying to carry foals, most likely they both do not survive.
Correct. Yeah, I agree, because you do hear about these stories like, oh, this mare was able to carry twins. It's like, well, that's the exception, not the rule.
Yes.
And we don't want to end up there on purpose. A quick 14-day check before that embryo has really implanted into that uterus. This is a great time to make sure we don't have that. I always say that's probably the most important check we'll do.
Yes.
Because twins can be a life-threatening situation. And if you find them too late, you end up having to terminate the entire pregnancy.
Right. At day 14, the embryos are still kind of bouncing around inside of the uterine wall. They haven't fully attached to the wall yet. That doesn't happen until, usually a couple days later. But at 14 days, we can very easily manipulate them, because a lot of times these embryos are, right on top of each other. They're hugging each other. So in order for us to kind of safely terminate one, we need to separate them out enough so that we can, protect the other embryo. And that's much easier to do at day 14 than it is, even a week later.
Yes.
Even a week later, it is much more difficult, and you have a much greater risk of accidentally terminating both.
Correct.
And then we're having to start this whole process over again.
So moral of the story, day 14 post-breeding, get it checked. I always say, when we breed that mare, we just go ahead and forward book it, put it on the schedule, day 14, rechecking the mare. This is not an appointment that needs to be missed. This is not something that needs to be taken lightly. We need to do this check.
Right. So. Exactly. So yeah, and then, kind of as we mentioned, our next check is usually 2 weeks later. About day 25 is when we can see that heartbeat. And so that's kind of our next little checkpoint of, do we actually have a viable fetus that we're growing? So getting to that point too, we can say, okay, we have this. We're growing appropriately. We're going to be taking measurements of that embryo, since, if we know the AI date or the ovulation date, we know exactly how old that embryo is. And so we can measure to make sure that it's growing appropriately, because some of these times if we're looking at it, we're like, this thing's a little small. We need to be really, really careful in watching it closely. Doesn't always mean that it's going to terminate, but it is something that we may, take a progesterone level early on and see, do we need to maybe supplement some progesterone through the first couple months of this pregnancy to maintain it and keep it there?
So let's talk a little bit about progesterone,
Right.
because progesterone is a hormone that the corpus luteum, which is after they've ovulated, the corpus luteum forms in the ovary. It starts producing progesterone, and that's what maintains the pregnancy. It kind of quiets everything down, tells your mare, hey, stop cycling. We got a baby cooking.
Yes.
We're going to let this progesterone take over. We're going to maintain this. Ovaries, I need you to chill out. So.
And that corpus luteum is going to maintain the first, almost third of that pregnancy. It's kind of the main star in that first, what we call trimester, because it's the progesterone that CL is cranking out that maintains it. And so at that kind of 100-day point is where the placenta is going to start kind of maintaining that pregnancy itself. And so once that takes over, a lot of these mares that maybe they don't have enough progesterone from that CL to maintain it. Once we hit that 100 days, usually we're in the safe zone as far as that. That first trimester is really our most kind of fragile portion of the pregnancy. I'd say that's where we see the majority of pregnancy loss. And unfortunately, we don't always have a cause for it. We have healthy mares, we, have checked their progesterone levels are good, or we're supplementing them, and, we've got good diet, we've got good management, and still sometimes we go in to check in that second trimester and there's no embryo. And it's sad, but, it's just something that happens. And a lot of times we don't have a reason for it.
And it is kind of frustrating because, especially when you get really close to that 100-day mark and you lose one, if you've got those endometrial cups that have developed, you've got that uterus that's starting to produce that progesterone, it's very difficult to get those mares cycling again in order to breed that season.
Yes.
And we talked a little bit about supplementing progesterone. That's Regimate. And a lot of these mares, if we know they have issues maintaining that pregnancy, we'll put them on Regimate shortly after breeding in order to just supplement that to make sure they hold that pregnancy.
Right.
And you can do all those things right, and you can still have them resorb. And you don't see any clinical signs of this. It's not like a late term abortion where you're going to see drainage from the vulva. You may actually find a fetus. These, they just sort of quietly resorb, and you come out and you do a check, and
it's gone. It's gone.
And that's, to me, if you can get past that first trimester, that first few months, you get to that 100-day mark, you're usually on autopilot then. But that first 3 is really critical.
It's very critical, yes, very critical.
And one of the things we've talked about a little bit is the nutrition aspect of this, and I do feel that nutrition is very, very important.
Yes. You're the nutrition guy, so.
My big thing I tell people is like, you always hate to use the analogy you're eating for 2, but because the actual fetus at that point in time, it's not very large. It's not pulling a lot of nutrients off mom. But you think about the energy and nutrient demands to grow a placenta, to produce all the amniotic fluid, to do all the things that are required in that first trimester. You still have an increased demand. The other thing that's really, really important is that first trimester is when we can still make progress. If these mares are a little thin, we can still make progress here. Because when we start getting into that last third of pregnancy, and especially after we fold and in lactation, if you start running the math, you physically cannot get enough calories into these mares in order to maintain body condition. You're going to drop about 2 body conditions during this process. And that's one of the reasons I'll push them a little bit heavier. I like some of these mares, and I don't want them too heavy, but if I can be that first trimester sitting at about a 7, that's a really good spot for me. 7s and 8s. That's kind of where I want to be in this first trimester, because now I got some reserves. You've
got some reserves, yeah. And if we're not at that point, if we're going in and these mares are a little thin when we're starting to, breed them, now's the best time to try to put some weight on too. So start increasing those calories and giving them good nutrition.
Because when the bulkier fetal growth in that third trimester, and these things grow rapidly.
It's like a pound a day.
Yes.
On average.
And that's a lot of protein. That's a lot of carbohydrates, a lot of vitamins. There's a lot going in to that last trimester, and that's why, physically they cannot eat enough.
No.
And this is also where I think quality nutrition matters. To me, quality nutrition always starts with forage. Supplemental grain cannot make up for poor forage.
No.
If you're wondering if you've got good forage, you can look at it, and that tells you a little bit of the story. We've talked about it before on here. If you've got a lot of seed heads, that's going to be a lower quality forage. But the best thing you can do is test your forage. Call your extension agent.
Yeah.
They can help you. We can run some tests. Equianalytical is a Dairy One company. You can go to their website, really simple to send in hay test. Find out what you're actually feeding, because that helps us out tremendously to determine what do we need to be adding. I would say feed and grain makes up for what your forage lacks, but it can only make up so much of that. So we need to really be fine-tuning and finishing up our nutrition in this first trimester. That's where we can still move the needle here.
Yes. And so I think kind of segueing into that, let's talk about fescue.
Fescue.
Oh, fescue, which there's a lot of that down here.
Yes.
Where I grew up, we didn't really have that.
That's our
north.
It's kind of our winter grass down here.
It is.
North Carolina has it, South Carolina. Pretty much anything, once you get off the coastal plain, you get into more of the Piedmont regions, and then some of the mountain regions, we're going to grow a lot of fescue. And fescue, I have a love-hate relationship with it. There's actually a lot of benefits to fescue, but then there's also a lot of fear with fescue. And if you have it, don't freak out. But you do need to be making plans for it's going to become a real factor in that third trimester.
Yes. And it's not the actual fescue grass itself.
True.
Is kind of the myth that we're going to bust here. It's not the grass itself. It's the endophytes, which is a fungi that grows on fescue.
And essentially, they have a symbiotic relationship.
They do.
And I've got, my pasture's at home. I don't breed mares there, but I've got old school 50-year-old fescue. This stuff's probably got more endophyte than it's insane. But it actually really helps it grow, produces great root systems, great biomass above the ground. They do have some endophyte-free fescues that can grow without the endophyte. The hard part is which one do you have?
Right.
Because even if you've planted fescue is also a volunteer around here. You got a seed bank in the soil. It's been growing in this region forever, so it's hard to say, do I have it, do I not?
Right. And so, kind of like what we were talking about with the ag extension, that's another thing too. If you can get them to test your pastures and see what types of grass you have, because I have a lot of people, I'll ask them, do you know what type of grass? And they're like, no. I'm like, call up your ag extension. They got a lot of people sitting around. That's their whole job.
And they're paid for it.
They're paid for it.
A lot of people don't realize
that's your taxes.
Your tax dollars go to support this ag extension agent. And they're able to come out and walk those pastures. They would love to come out and walk your pastures with you. Go through, identify these grasses. It costs you nothing, but yet it's a phenomenal resource. And the great thing I love about it is if they have a question, they're your direct link to the super nerds up at the university. So your super nerds in the plant sciences, soil sciences, and in every aspect of agriculture. These are they can get you in touch with the super nerds. So if they don't know the answer, which I'll be honest, most of them are very, very, very knowledgeable. But if they don't know the answer, they run this up the chain to the super nerds and they get you the answer. So absolutely use that extension engine.
Yes, absolutely. You're already paying for it with your taxes, so might as well.
And me, that first trimester, fescue, I'm cool with it.
My rule of thumb is if you can avoid it, go ahead and get it out. Like if you have other options for hay or for pasture that you can use, just go ahead, get them off of it so that we don't, forget to do it later. But if I'm not asking you to go rip up your entire pasture if your whole pasture is covered in fescue. That's a little excessive, but.
And when it comes to this hay scenario, one thing you need to know is when hay is produced, and if it's fescue hay, and I always hate calling it a toxin, but I guess in the true definition, the toxin that is produced by this endophyte, it is more concentrated in hay than it's in grass. It's just because we removed all the water. So I do not like fescue hay in these horses, which I always hate, because if you ever look at the nutrient content of fescue hay that's baled correctly, it can far outshine a lot of other products out there. It's a great feed product.
Good fescue can be better than crappy Timothy.
Yes, but it's in the situation.
Yes,
So I think that's important.
And the reason we don't like fescue, and that it is a risk, and we say, hey, don't do this, is that it affects mostly late term pregnancy is where we see these. So it can cause a couple different things, really abnormally long gestation periods, kind of outside of that realm of what we were talking about earlier with those, kind of normal ranges. It will also kind of stop their lactation or prevent them from bagging up at all.
Right.
Aggalactia. Aggalactia. It can lead to abortions, and probably the scariest in my thing is the premature placental detachment or the red bag.
Yes.
That's, again, it's not the only cause of red bag out there, but we have learned that it is, one of those predisposing factors for red bags. So
and these placentas, they're very thick.
They're very thick.
When you have that red bag, this placenta, it's normally just like a membranous type structure, but these things are very, very thick with horses that have been on fescue for long periods of time. So
yeah, so if that is something, then talk to your vet about it. We'll come up with a plan. If your mare's been on fescue and we don't really have an option to change the hay or get her off the pasture, we can make a plan. It's really, I'd say, most important during that kind of third trimester. So about month 7, month 8 is where we say, hey, we need to get them off. And then just kind of start, monitoring, make sure that as she is getting closer to her term date, make sure she's developing an udder, make sure she's got milk production, kind of watching our gestation date, making sure that, we're kind of staying where we need to be.
Well, and it becomes important too, because when you look at the timing of a lot of these things, like I said, here in Georgia, fescue's a good winter grazing. It's a good cool season grass, which unfortunately falls in that last trimester.
Yes.
And then also with the Aggalactia, it's going to fall right there during foaling. And so the worst time of year to have fescue for the mare and during this pregnancy is also when fescue is doing the best. Like you get that spring grain up that's coming right now. A lot of the grass you're going to see, these clump type grasses that are really thriving right now in March and in April, they're going to be fescues. But like I said, I don't want to make fescue sound all bad, because I personally like fescue. Like it's a great cool season grass. It prevents. With fescue pastures, you don't have to buy as much hay. But like I said, when you're dealing with brood mares, let's avoid it if we can.
Yeah, absolutely.
So let's get into the second trimester. All right. So we kind of call that's usually between month 4 and 7. There's I would say now we can take a breath. We're gonna most likely, this pregnancy's here to stay. We can breathe a little bit, not a whole lot going on, but this is also where we start preparing.
Yes, this is where you want to have your plan. So we kind of talked about in I think the first episode about vaccines. So getting your mare's immunity up, because when the foal is born, it doesn't have an immune system.
None.
The immune system that it does develop is going to completely depend on what the mare herself is starting with. So keeping her up to date on her core and any recommended vaccines. So your EWTs, your West Niles, your flu and rhino, rabies, and then the pneumobort vaccine. So this is a vaccine specifically for equine herpes virus that is linked to causes of abortion. It's probably the most common recognized forms of abortion. Again, we talked about with a lot of these, miscarriages in horses, we don't always identify a cause, but this is probably one of the ones that we can identify, and we see it frequently, and we know that it's there. We have a vaccine that can prevent it. So we like to booster these girls in month 5, 7, and 9. And that's also a good time to be checking the pregnancy. So month 5 is kind of that transition to see if we made it out of that first trimester. And then month 9 is, kind of going into that final stage. So that's where, it's good to have a little conversation about, hey, we're entering that final trimester. Let's, check, make sure our fetus is growing. Let's talk about, our birthing plan. Let's talk about our nutrition, make sure we're staying where we need to be. So it's kind of good checkpoints to have with your vet when you're doing these vaccines in general.
Well, and I think it's important when we talk about vaccines here, let's kind of go all the way back and let's just do a little bit of a vaccine discussion as pregnant mares. Because like you mentioned the EWT West Nile, you mentioned the rabies, things like that. Some of those we need to have on board before pregnancy. So like rabies, we want to think about that before we start breeding.
Correct.
So we want to have that rabies on board. That first, like when we're actively trying to get these mares pregnant and during that first trimester, this is not a good time to be updating vaccines. You're going to get an inflammatory response when you give a vaccine. When we're trying to make this baby, we don't need any help with inflammatory responses. So kind of backing up, we want to have the planning starts before the planning starts.
Yes. So go back and listen to a couple episodes ago where we had this whole discussion.
Right. So make sure when you're getting in there. So this is why we're starting in that 4 to 7 month. Again, now we're planning because also you don't want to be a week before foaling and say, hey, we should booster all these vaccines. Right. Because again, this is also a time when inflammatory response is not the best of ideas. So getting these knowing the timing on this in that second trimester, making sure that we're getting these vaccines in when they need to be. This is pretty critical.
Absolutely. And at this point I kind of say that we're just kind of coasting through pregnancy at this point. I have a lot of people ask me about exercise in our mares. So can I ride them? Can I show them? My rule of thumb is if your mare's never really been ridden or done any exercise before, now is not a good time to start. If you have been riding her, riding is actually totally okay up until about month 7, month 8. I wouldn't say, go on a 10-hour trail ride with her. But, moderate exercise is very good for these mares if they're used to it. I do not recommend showing. Any sort of travel where you're going to potentially expose these girls to infectious disease, the additional stress of trailering places and, being in new environments, even if they are used to it, even if they are a show mare and they've been here, there, everywhere, I don't recommend it. It's unnecessary stress, and especially during that first trimester of that pregnancy, we don't want to induce any extra stress. Like we're carrying very precious cargo.
Yes. Well, and I think that's important because, going back to, we're going to be boostering that equine herpes virus 1, the pneumobort. We're also going to be boostering that EHV4 because we're trying to prevent this. Well, some of the most common pathogens you're going to encounter when traveling, like if you're going to horse shows, going to public venues, it's going to be influenza and it's going to be herpes. Those are going to be some of the ones that are most common. We're trying to prevent that.
Yes.
So let's don't go look for a source of it.
No. And I recommend too, just keeping these mares in a separate area with all the rest of the horses in the barn that are showing or, going to public places too, just because, even if she is up to date on all of her vaccines and the other horses are as well, they can bring things back with them. And a lot of these, viruses and other pathogens, they can be pretty hardy and they can travel along with them. So, just a lot of, bigger barns, they kind of keep their brood mares separate from everybody else. They've got their own little herd that they're with and everybody else is in a different area. So, just be very careful with them. You can absolutely still kind of continue some life as normal with them. And routine is really good for horses. Horses are, creatures of habit. They don't like big sudden changes to things. So, we can still do exercise with them. Again, if she hasn't been ever ridden in her life, now is not the time to start riding her around.
Yeah, I think a lot of it's kind of common sense, right? If people are pregnant, you don't get pregnant and think, oh, what's a good thing to do right now? I'm gonna start training for a half marathon.
Yeah, man.
But if you're an avid jogger when you get pregnant, I remember my wife went through this. Doctor's like, yeah, you can still jog, you can still exercise. Not time to take up the new hobby of marathon running.
No.
No. A little common sense. And the other thing that's important too when we're talking about the health of these mares is when they're pregnant, there's certain medications they cannot receive.
Yes.
So if they were to get sick, our pool of medications we can use to treat these mares is a lot smaller.
It is.
Than what we could use if they weren't pregnant.
It is. Yes, it is. So I'd say probably the biggest one we think of is steroids.
Those are out.
Steroids are a big no-no. So, I mean, even joint injections, we totally avoid that in them, even though the steroids are kind of going into a singular spot, we don't even take that risk.
Right. So, and there's certain antibiotics that we cannot use. And so we don't want to end up with an infection that we need Baytril for. That's not a great option. So,
no.
It's you really want to be cautious during this time period.
Yes.
Like let's focus on preventing sickness, preventing disease, because like I said, our what we have medication wise gets a little more limited during this time. So,
absolutely.
This is also, like I said, you're in coast mode, and I tell you the biggest thing you're probably watching for is if you start to see early mammary development, they start bagging a little bit early. If you see any kind of discharge from the vulva, those are. I tell you, just keep an eye on that. You don't need to be out there every day, like looking at this udder, looking at the vulva. You don't need to obsess over this, but it's just something you need to pay attention to.
So basically, and what we're kind of talking about here is placentitis, or an ascending infection of the placenta. And so this can occur kind of anywhere from about month 4 on. I'd say most of the time I'm seeing it like month 7. I don't know what it is about like month 7 that it seems to pop up. But basically what happens is this placenta becomes infected with some sort of ascending infection from the outside world up through the vagina, through the cervix, and then into the environment. And the body recognizes that infection and it says, I gotta get this fetus out of here. And so the mare's body will start to kind of prematurely prep for this birth, and so you'll see this bag development in a mare that's only about halfway through a pregnancy. And we get a lot of people that call and they're like, what's happening?
Yes.
And we say, we need to get involved right now.
I like to say this is not a wait and see.
This is not a wait and see, no.
If you even suspect this bag looks larger, if you even suspect you see softness or swelling in the vulva during this time, this is a hey, and we're going to get there. Because this is something that's we need to get on early if we're going to save this pregnancy.
Yes.
It can get to the point where we can't slow it down.
Correct.
And I think that also becomes important because you talked about ascending infections, but hematogenous spread is another risk of this. So again, preventing these mares from getting sick, so we don't get what's called a hematogenous spread. Or in hematogenous, where some bacteria catches a ride in the bloodstream and ends up going to the placenta.
Right.
This is not good.
That's not what we want. So
because again, we're limited what we can do antibiotic wise, and like I said, if you're seeing bag development, this didn't just start today. This has been going for a minute where we can just now actually see it. So that's not a wait and see.
Correct.
That's a give us a call. We're on the way.
And it's not a death sentence to the mare or the foal by any means. A lot of times these are treatable conditions. We usually are, watching the pregnancy very closely after that, and then once the foal is born, we're checking for signs. I know in some conditions, especially if it was a little bit more chronic of a placentitis, they will just preemptively treat the foal with some antibiotics coming out. So just to, kind of check all the boxes. But, these foals can go on and develop completely normally and be completely fine. And, just because a mare has placentitis in one pregnancy doesn't mean that she's going to get it in her next one. But it is something that, again, like you said, we don't want to wait around on this.
Right.
Because this can be very detrimental. And again, especially this late into the pregnancy.
It kind of keeps with our theme: early aggressive intervention. Early aggressive intervention. That's where this needs to be. This isn't sit around, wait, sit around and hope. Hope is not a plan. We need to be involved.
Absolutely, absolutely.
But yeah, that's pretty much it on like I said, the second trimester. We're kind of coasting through life here, and it's we're getting prepped, and then we're gonna roll in that third trimester, and this is where
things get fun.
Yes. So. Now we're growing a baby.
We're growing a baby, and we're growing a baby fast. I think we said it earlier. I mean, these foals are growing, on average, a pound a day, which is crazy.
Well, and you think about it, that doesn't mean they're taking a pound of food and making a pound of baby. Because we still got to feed mom, feed the placenta, make amniotic fluid, and it takes way more than a pound of feed to help a foal gain for a pound. Like this is a nutrient demanding time of pregnancy.
Yes, and this is where too these mares, they start to look bigger, they start to fill out. These foals are taking up a lot of space in their body, and so a lot of times we need them to eat, but they don't want to because they've got this giant alien in their abdomen now. And so that's where we, kind of talked about earlier, again, circling back, is having really good quality nutrition. And so, getting the most amount of calories in them without having to feed tons and tons of volume.
Right. Because the volume's just simply not going to be consumed.
No, because they're like, I don't got room for that.
And this is also why we kind of put a little extra weight on them. That's like our savings account. That's our savings account, because now we're in the situation they can't eat enough to maintain all their nutrient demands. We're going to start pulling nutrients.
Yes.
And like I said, this is also a reason to decrease exercise, because if you go back to one of our nutrition podcasts, I try to keep things pretty simple, and you need calories and nutrients. Let's say you need nutrients to live. You need nutrients to exercise. You need nutrients to make a baby. You need nutrients to grow. And with these mares, they need nutrients to live, nutrients to make a baby. You start adding strenuous exercise in, well, now we're robbing nutrients.
Exactly.
So just let them make a baby.
So yeah, light exercise for them is walking around in a pasture.
That is great exercise.
That is great exercise for these girls. So.
Yep. So the other thing is we're looking at having to booster a couple vaccines. This is where I like to say we're not thinking we're making colostrum.
Yes.
We're not vaccinating. We're making colostrum. Colostrum, for those of you that haven't listened to that podcast, that's that first milk that she produces, and it's that first milk, and we've got to get that into that foal within that first 12 to 24 hours. It needs to be there.
Usually, we want them nursing by 2.
Yes.
By 2.
Like that's our window, because after when you start getting past that 12-hour mark and getting close to that 24, they can no longer absorb these antibodies, because basically we're going to pass a ton of antibodies to that foal through mom's milk. So we got to make mom's milk as antibody rich as we can.
Yes.
And that's what we're focused on here with these vaccines.
Yep, vaccines, and the kind of lactation too, what we talked about, that'll usually start kind of producing about 3 to 6 weeks. I've had some mares do it like 48 hours before they foal, but you'll see that bag kind of growing. Usually that milk starts kind of watery, and then it starts to kind of thicken in consistency. There's a whole lot of different commercial products you can use to kind of check the composition of the milk, because the calcium will start to increase in that milk as she gets a little bit closer to that date, and you kind of watch the milk like change colors over time. I'm always say be cautious with that. I don't look. Some people go balls to the wall with it, and they start like really milking out their mare with it, and especially once you get close to that foaling date, you don't want to take all that colostrum away.
No,
you don't want to do that.
Because the baby needs that.
The baby needs that.
Your test doesn't need it.
No.
Your bucket you're catching it in doesn't need it. The baby needs it.
The baby needs it,
and that mare only makes so much. So.
But it can be a good way just for you to kind of track and see, like, as your mare is. So, if you're watching at home, like for your own, kind of sake of, hey, when do I think my mare is going to go? It is a good test to do, and it just kind of helps with kind of keeping track of everything. And yeah, so you'll watch that bag grow, and the waxing is where the magic happens.
All right, so these mares, they're waxing up, and this is when you're getting close.
Yes.
I like to say, you like, for those of you that may remember, Butterball used to put this little thing on a turkey. You know what I'm talking about? It would pop up when it was done. And I remember being a kid and like watching that thing just kind of starting to want to move a little bit. That's like that turkey thing starting to starting to move. Like we're getting close to done. We're baking this thing, and it's getting real close to being done. And we start seeing that wax.
It's like little candles on the
Yes.
tips of their teeth. So that's the actual colostrum. And so when you see that, I say you've probably got about 24 to 48 hours before your foal comes.
And this is the time to leave that alone. Its whole job
touch it.
is it's plugging that teat so this colostrum doesn't drip out. This mare's worked really hard to make this colostrum, and it kind of caps it off. Like don't touch it.
Don't touch it. Don't touch it. It's very tempting. Don't touch it.
Touch it, because a lot of times you'll pop that cap off, and you don't even have to touch them again. They just leak and drip, and then you're watching one of the most precious things in the world just dripping out on the ground. I mean, it's terrible.
It's
So
terrible.
Don't do that.
Don't do that. Please don't do that.
So we're getting exciting. We've waxed up. Here we are. We're getting ready to deliver. Some of the things we need to be watching for.
So we've talked about the bagging up, the lactation. Some of the other changes too is the tail tone. So a lot of those muscles around their hind end will start to loosen up. So you'll see their vulva get really long. Their tail, you can, kind of pick it up and very just gently lift it up really easily. And if you're doing that every day, checking your mare, you'll see as she gets closer, it's very easy just to kind of lift it up. And that's just everything kind of softening, getting ready to deliver. These mares also tend to get very crampy too. The foal is, a lot of times as the foal is developing, their head is, kind of facing forward, facing towards the mare's head. But to get into the delivery position, they have to do a full 180 and get themselves to be facing the back. And so that in and of itself is a very uncomfortable position. So usually I feel like a lot of people give me a call, usually about a couple weeks or even a couple days before these mares end up falling out, and they're like, she's really uncomfortable. And then you just see this big mass making its way around.
Yeah, I mean, you're sitting there with 100 pounds of foal, and Lord knows how much amniotic fluid in there. I mean, you're dealing in gallons of amniotic fluid, and water's 6 pounds per gallon.
Yes.
And then you got this placenta, and then you've got all this extra weight.
Yeah.
And then this thing's like, oh, I'm gonna turn flips in here.
Yeah, I'm gonna start somersaulting in here. And so so you see a lot of changes in your mare. So I'd say one of the most important things for me is figuring out where you want your mare to foal and getting her used to that environment before these changes start happening.
Yes.
This can be a kind of a stressful time for her, especially for these maiden mares that have never done this before. And so, if your mare's never been in a stall before, but you want her to foal in a stall, start getting her used to that stall months before this happens. I'd say that, our ideal foaling environment is you want them to have access to shelter. If they are going to be outside, you want them to have, be able to get away from the elements. You want them to have somewhere that's, dry and comfortable. They want to have lots of room so that they can, kind of get up and down. And you want them to be able to get away from pasture mates too. Right. One of the things that can happen, as I've seen, is, horses that are in a field together with a bunch of other horses, whether they're other brood mares or, geldings or whomever. Once that mare starts foaling, everybody else gets a little interested and they start coming over. And your mare doesn't really want that extra attention. She wants to be by herself. And when that foal comes out, something is gonna switch in her brain, and she's gonna get very protective of that foal. And if she's having to fight off a bunch of pasture mates, that can cause a lot of extra stress, and we could potentially risk hurting the foal in that. So, separate her from everybody else. Let her have her own space. If we're doing a stall, I say bare minimum 14 foot by 14 foot. You want enough for her to be able to, get up, turn around. I like to bed them with straw. Shavings can stick to the foal. They can accidentally aspirate them, which can lead to a pneumonia. And the straw is just a little bit easier to keep clean too than there. You want to, keeping it clean, mucking it out every day, making sure we're getting rid of any old manure and urine and anything in there so that this foal isn't getting born into, everything.
Well, and I think what you said was so important about starting early.
Starting early.
This is not, and when we say early, we don't mean like a couple weeks before. A couple months. We want this to be habit form. We want them to know, like, even if it's like, okay, I'm gonna stall her at night and have her out during the day. Well, let's go ahead and start that. Let's start that early.
Yes.
Not last minute. Again, second trimester is about preparing for the third trimester.
Yes.
You're in coast mode, but this is where you can go ahead and start creating that routine.
Yes.
So,
because having worked with some of these brood mares that have never been in a stall before, and then we just put them in a stall, like, their mind is blown.
And you know, some people are like, I'm going to take my mare somewhere to have them fold out. We'll find out what that situation is, because if they're pastured at your house, but you want them fold out somewhere else, if they're going to fold in the stall, you need to start preparing them for that stall now. Not you ship them over. So what you don't want is a week before they foal, you load them up in a trailer, ship them somewhere else
that they've probably never been before.
Never been before. Stick them in a stall, which they haven't been in years, and wish them well. This is a lot of that added stress. So the more that we can remove, the better. So setting up your environment is super important, and I recommend stall cameras personally. I love stall cameras.
If you're going for the stall route, stall cameras are great, because one thing about mares is they can be very private when they're foaling. They're most likely not going to do it, in the middle of the day with everybody going up and down the barn aisle. They're going to wait until it's quiet, there's not a lot of people around, and I can guarantee if you're standing in front of their stall watching them, they are not going to foal.
Right.
They're going to wait until you get up to go do something else.
Yeah, just stand back, watch them on the camera.
Watch them on the camera. That way, you can see as things are starting to change, and in our other episodes, we kind of talk about, what those different stages of labor look like. So you'll start to see those changes, but the camera's a good way to, kind of sit back, and you can still be involved, but, let her do her thing. She doesn't know you're there, so.
Well, I think that was a great walk through the whole pregnancy process. Let's hit a few highlights, like our takeaways, our topics, and if you only remember, like say, if you can remember 3 things from this, what would that be?
I'd say, number one is that first trimester is our most important for kind of making sure that this mare is set up for the right pregnancy. So, making sure that she is in foal and that we don't have twins, making sure that our fetus is viable and that, we've got enough progesterone to kind of get her through this. And then, being as prepared as possible, having a plan. This is a year of your life, and, a lot of it is, there's not really a lot involved in kind of the middle section, but it's a good time to, start preparing and start thinking ahead about, the end that's in sight. And so, getting there, and then, number 3 is just have a relationship with your vet. This is, if we've, gotten your mare to this point and we're getting there, hopefully you've already been working with your vet and kind of talking through these things, but just having them involved and, getting their vaccines done, talking about, nutrition and just what to kind of expect, and being able to intervene when we need to.
Right.
So, I'd say those are kind of our biggest points here.
I'd agree 100% with that. 100%. Because, your vet's can help you walk you through this.
Yes.
I always say you wouldn't have a baby yourself without having an OB involved.
Correct.
So that's kind of the role we sort of step into here, and we want to be there for you. So, all right, that was a great topic. I hope everybody learned a lot from this. I always enjoy these. I used to do a lot more repro work, and I don't think I catch the occasional foal, and I'll be honest, it's kind of fun to get that call for the newborn foal, because I don't get those much anymore. But it's kind of an exciting time. Like I said, there's a whole lot of hurry up and waits, but at the end of the day, when you see that foal being born, you've got the new foal running around. That's a pretty awesome thing.
That's my dopamine. That's I'm like, I made that baby.
So doing things right from breeding all the way through this pregnancy sets us up for that happy moment. Because like I said, it can also be one of the most heartbreaking times.
Yes.
And
absolutely.
Our whole goal is we can't take all the risk out, but the more of it we can minimize, just the better for the mare, better for the foal, better for the veterinarians, better for the people. There's no downside to doing this right. Like I cannot think of a single downside to any of this.
No.
So let's just do it correctly.
Fix what we can.
That's it. Well, everybody, thanks for tuning in. Hope y'all enjoyed it. Like I said, if you've got questions, y'all been great. You've been sending a lot of topics to us. We were trying to get to them all. We're going as fast as we can.
We have a whiteboard of
yes.
everything, and it's growing.
And we're about to have to get a second whiteboard, so we're powering through these. We've really enjoyed it, so keep sending in the comments, keep sending those DMs, keep sending in those emails, phone calls. We really appreciate it, and hope y'all enjoy it. And we'll see y'all next time. Thanks.